All of us are hardwired for these survival instincts that really don't serve us anymore. The fear that we have that holds us back, the hesitation that we have that holds us back, it's really a feature of our species. But we're also hardwired to be incredibly curious and explore the world and discover new things. And that, just lights up our brain with the flow of all these positive neurotransmitters.
Welcome to the Hard Way podcast with Joe De Sena, founder and CEO of Spartan Races. We're teaching you how to overcome your obstacles in your life the same way we teach our 10 million plus Spartans to overcome obstacles on the course, with insight from the smartest, most accomplished experts from every corner of the world. Get ready to elevate your life today.
Joe De Sena here, CEO and founder of Spartan and the Hard Way podcast. Used to be called the Spartan Up podcast. Now we call it the Hard Way podcast because going the hard way is the right way. Anyway, I got Jeff Karp. I don't know him as Jeff Karp. In my phone, I have Harvard doctor because that's how I know him, because I'm so impressed that I know anybody from Harvard, let alone a doctor. For the last 5-6 years, anytime I have a jam anywhere in my life, God forbid somebody gets sick, I hit up Jeff. He takes care of it. He knows how to get to the right person. So if you have a problem, reach out to me. I'll ask Jeff, Dr. Karp. So let's just set the table here. You work for a bunch of universities, you work for a bunch of hospitals, and you help them innovate? Or tell me, what do you do?
Yeah, so I am a biomedical engineer, a bioengineer by training, actually chemical engineer as well. And I run a research laboratory at Brigham and Women's Hospital. And my faculty position is through Harvard Medical School, but I also have affiliations at the Broad Institute, at MIT through the Health Sciences and Technology program there, and then also the Harvard Stem Cell Institute. And my laboratory really focuses on the process of medical problem solving, and it's an ever-evolving process. We're constantly iterating and editing and adding to it, and then we take that process and apply it to many different problems with a major focus on trying to accelerate the timelines essentially to get new therapies into clinical trials and hopefully to patients.
Because is that the big issue? The big issue is there might be a cure out there for, you name the disease, there might be a solution, but actually getting it from idea to commercialization is the big problem?
Yeah, there's a lot of challenges. I think one of the big ones is often, not always, but often is the biology, do we know enough about the biology? That's usually one of the key things that, like when there's a new biological discovery, that almost kind of unlocks the opportunity to then move new therapeutics forward. And so that's something that we're always thinking about and trying to gauge. We're constantly making assumptions and taking risks. And I think that it's just kind of like, we dig into the biology to get a sense of, do we think there's enough known there? How big of a risk are we really taking by trying to try and solve this? Sometimes we even kind of step back and do some basic biological studies to try to unlock that further. So that's kind of one big piece of it. Is that understanding of the mechanisms of the disease or whatever we're trying to treat, is that known enough? And then another big part of it is, as you're referring to, is the whole entrepreneurship part and, getting the right people around the table. Because what I've realized is that in the laboratory, there's a lot of challenges to just get proof of concept and move things forward and have something promising kind of come out. And you need incredible diverse team that are super creative, but you actually need that kind of a team through the entire process. So the entrepreneurial team, and then even thinking through clinical trials and the patent strategy and how you're going to bring this to market. It's just each one of those is a Spartan race.
It's an obstacle.
Yeah.
Every one of those is an obstacle. Yeah, so I think people listening or watching out there, we would think, human beings would think that if in the laboratory something looked promising, it automatically makes it to market because it's going to save people. Yeah. But you're right, it requires shepherds, and they have to go raise money, and they've got to convince investors that they're going to get a return. Like, there's a lot that goes on, and I bet you, I don't know what the percentage is, but it's got to be a big percentage that just flame out, not because it's not promising, but because
Yeah.
the obstacles break people.
There's so many obstacles, even the clinical trial design. If you get the design wrong, and it's easy to get it wrong because every therapy requires slightly different, thinking and process to get things in order to have a chance of, moving things through. Another big thing is manufacturing. A lot of technologies that are made in academic labs just can't be manufactured at scale, or there could be quality control issues. So there's a lot of different challenges. And that's one of the things we try to do in my laboratory is we try to think about the problem not just as a medical problem or a biological problem, but we think of it as almost like a Venn diagram where you have these circles that are overlapping, and one of the circles is manufacturing, one of the circles is the clinical trial design, one of the circles is, would investors invest in this? Another circle is the biology, the mechanism. Another one is the is the medical problem, and then there are others as well. And then we try to look at the overlap between them and really think about that the entire way as we're trying to solve these problems. And so that if we kind of move things along, we've already been thinking about the manufacturing, we've already been thinking about the intellectual property and the patents, and we've already been thinking about if this were to make it in a clinical trial, what would we be comparing to? Because we want to include that early in our experiments in the laboratory. And that's how we can really define whether what we're doing is important or not.
You've thought about this a lot. You've been doing this a long time. You wrote a book, because you and I have been talking about this book.
Yes.
That's coming out in a year. I mean, putting final touches on it.
Yeah, it's coming out in under 5 months. So yeah, it'll be in April the 9th. And it's called LIT, Life Ignition Tools.
And the reason I ask about the book is because do we need all these laboratory-based solutions if people lived a healthier life? And by the way, I don't even know what the final details of the book look like. So give us an overview.
Sure. Wow. There's a lot in your question there, and my mind's kind of swirling because there's so many interesting things to talk about. The book is really about intercepting routine patterns to actively think and decide versus just jump in with habitual responses. And it's really about how all of us are hardwired for these survival instincts that really don't serve us anymore. The fear that we have that holds us back, the hesitation that we have that holds us back, it's really a feature of our species. But we're also hardwired for things that we can tap into to really overcome that fear, to overcome that hesitation. We're hardwired to be incredibly curious and explore the world and discover new things, and that just lights up our brain with the flow of all these positive neurotransmitters. We're hardwired to deeply connect with people, and for that to really just feel incredible and to help us carry us through life in the most fulfilling ways. We're hardwired to be able to really intercept patterns that don't serve us anymore, and to really be open to the cues that are constantly kind of shining through, like through our minds and our bodies and our interactions with other people. We have these flags that are constantly coming up that are helping us to guide us on our path. And often, because we have this information overload in our world, because we have stimuli coming at us from all these directions, we often miss these cues. But they're all there. They're all there to guide us. And so the book, LIT, is really about tapping into what's already within all of us, and really
it sounds like Native Americans had it figured out. Is that a fair assessment?
Yeah, we interviewed over 40 people in the book, including an Indigenous leader. And I think that, we were talking about health, like the Indigenous ways of treating disease are just more holistic. They're more, it's not about, today, kind of modern medicine, we zoom into like a specific disease. But the indigenous way is really to consider, all the various aspects, the other body parts, and to think
and how they're living their life.
Yeah, the interaction with the environment, interaction with other people, like all these things are important to consider in, in someone's health and wellness.
So a silly example for anybody listening or watching this, you're living next to a garbage dump like I did growing up, and it's toxic, and people around you are all in organized crime, killing people for a living, and you get sick, and the doctor hones in on that sickness. Maybe we should be zooming out and saying, wait a minute, you live next to a garbage dump, you live next door to people that kill people for a living. We need to change your lifestyle.
Yeah. I think that, there's really something to thinking about and I think it goes even beyond just a particular disease, but I think just wellness in general, and even like mental health and just, how we experience the world. I also think that when we think about sort of our capacity as humans, right? Like this instrument that we've been given, and these incredible senses, these incredible ways that we can experience the world. And it almost seems as though we have like a narrowing of the senses that we use to experience the world. Like, for example, one of the things that I've been practicing recently is slowing down. So what I notice is that when I start, let's say, like walking, I'm accelerating always. I've been doing it my whole life. Like I walk extremely fast. My wife's like way behind me. Most people are way behind me when I'm walking. And I started to slow down. And what happened is that all of a sudden I could get in touch with the sensation of my feet touching the floor as I'm walking. And it's it's like a nuanced, pleasurable experience when you do that, when you start tuning in. Like right now, let's say we're talking, but what if for a moment we just sort of feel the sensation of this couch on our bodies, right? And how we're interacting with it. Like you see that shift of attention causes a different experience. We've just experienced the world in a different way because we've shifted our attention. We've pinched our brains to be able to shift the focus. And I think that it's just so powerful. There's so much that we've been given, and we can experience the world so much more deeply if we just use our attention to, kind of shift our focus to the different senses. And we talk about this in the book.
I'm excited for the book. Let's switch gears. You created a new product. You've created tons of products, but this particular product's come to market. We have it here at our event. It's a nasal spray. What's it going to do for us?
So, so what happened was in March of 2020, when COVID was just really ramping up when it hit, we were developing a nasal spray to treat multiple sclerosis, and pretty much the lab came to a halt, and we immediately said, okay, well, how can we help? How can we help with COVID? And so for every single project in the lab, we started to think about what we might be able to do. And the biology was being quickly discovered and worked out. And what we found was that when we looked at the literature to really understand what was happening, that COVID, one of the main entry points is in the nasal lining. So there are these goblet cells and specific receptor that it can interact with, and so that's one of the ways that it gets into our bodies. And so we started to think, okay, well, what if we could develop a nasal spray that could form a barrier layer in our nose so that it couldn't get to those goblet cells? And what if we could kill the COVID virus as soon as it contacted that lining, that barrier that we created? And in addition to that, one of the principles that we like to use in the lab is called radical simplicity, and this is, we kind of learned this the hard way, where we tried to develop medical products and they were just too complicated and they couldn't make it to market. And so what we did is we said, okay, is it possible to design this nasal spray so it only had safe ingredients that had been previously used in nasal sprays or other sort of consumer products, and no drugs? And the reason why is because we thought, okay, maybe if we could do this, we could bring this to market more rapidly. It could potentially be regulated as a cosmetic. And so we looked at a 100 different combinations of agents that exist in current nasal sprays and other things. And we actually found a composition that could kill 99.99% of COVID-19, H1N1, influenza A and B, adenovirus, E. coli, pneumonia,
It's a Spartan shield.
Yes, yeah, it's a
Spartan shield for your nose. So you
Yeah.
spray you spray it in your nose every day, or?
So, well, what we're thinking is that, like, before going to, let's say, on an airplane or going to a concert or an event or a meeting or a restaurant or going into work, you could spray it. We have 2 regulatory consultants who looked at the ingredients. They said all our ingredients are safe. We also have an international toxicology consulting firm that we engaged. They said all our ingredients are safe. So we just brought it to market on October the 10th. It's called Profi, and you can actually get it. It's called profispray.com is the website if anyone wants to check it out and learn more. We also have a paper that we put online that has all the detailed scientific results, very rigorous studies that we've performed to demonstrate the efficacy and the safety of this spray.
I love it. I told you this guy was unbelievable, right? MIT, Harvard, knocks out a book, Profi Spray. Last question. What do you got that you're working on that we don't know about?
So one of the things actually that we've been working on for a while, but now we're exploring new applications for, is in the laboratory we developed a tissue glue that could seal holes inside a beating heart and could seal blood vessels. And
I have a hole in my heart.
You do?
Yeah.
Okay. Yeah.
So 20% of the world apparently has a hole in their heart.
Yeah, so that's actually how we started out on this project. We were working with Dr. Pedro Del Nido at the Boston Children's Hospital, who treats babies who have congenital heart defects. And some of them have these holes in between the chambers of their heart called a septal defect. And it can be, if it's a certain size, it can really present to be a big problem. And the challenge is that when he goes in to try to repair it, sometimes the tissue is so fragile it just tears. And there's devices that work for adults, but you can't downsize them because as the child's heart's growing, these are permanent devices, it just outgrows the device.
So you came up with a glue.
So we came up with a glue that can work in the most harsh environments inside the human body. It can work inside a beating heart. It's a very challenging environment because it's extremely wet, and you have blood cells covering every surface, and then you have the rush of the blood, 60 beats a minute. So if something attaches, it can just delaminate, and then you have the expansion, contraction of the tissue as well. So we developed a biodegradable glue that when it cures, it also has elastic properties. And it actually has some hydrophobic properties, so it can repel the blood away from the surface of the material so that it can actually attach, and then it infiltrates into the tissue, and then we shine light on it and it cures into place. And so now we have 2 clinical trials advancing in Australia, one for tactless hernia repair. So often when you have a hernia, you get a mesh put in, and then you get these tacks, which are very stiff materials, and they place them all around in the mesh, but it causes a lot of pain, and they can also kind of migrate around, and it's a big issue. So what we've done is you can take a hernia mesh and there's a grid, and you can put our glue along this grid, and then you can put it in, you can move it around until you get it to the right spot, and then you just shine the light and it cures it in place. So that's in a clinical trial. And then we're also exploring this glue for sutureless nerve reconstruction. So when people have a nerve that's severed, usually one of the go-to strategies is that there'll be a tube, and you kind of stuff the nerve into the ends of the tube, and then you suture the nerve to the tube, which can then damage the nerve even further, which is a problem. That's kind of the state of the art right now. So what we can do is, instead of using sutures, we can use our glue to glue the nerve to the tube, and we can also make the tube out of the glue material. So you have consistency in the materials that are being used, and we can add guidance channels to guide the neurons to connect. And so that's in a clinical trial right now as well.
I love it. This guy's unbelievable. I want to come back as you. Thank you, sir. Thanks for coming.
Yeah, thank you.